Our next presenter is presenting on a presentation titled Culturally Tailoring a Diabetes Nutrition Education Program for Tribal and Urban American Indian and Alaskan Native Communities. Please join me in welcoming Sarah Stotts, Kelly Moore, and Heather Pontius.
Good afternoon. I'm Kelly Moore. I'm Muskogee Creek and a pediatrician on faculty at the University of Colorado Anschutz Medical Campus. On behalf of the What Can I Eat team, I'd like to thank the American Diabetes Association and the Shakopee Tribe for this exciting opportunity to develop a new nutrition education resource for our tribal community members with type 2 diabetes. Mado. Sarah?
Thank you, Kelly. And I'm Sarah, and here's our objectives, what we hope to get out of the next 6 minutes of our presentation. And we're really grateful to be here. Okay, so as many of us know, nutrition education and diabetes self-management support can help improve blood sugar management, help manage blood pressure, help decrease food insecurity, and can also help with prevention and management of chronic diseases and complications that are related to diabetes, such as heart disease, high blood pressure, and kidney issues. So the overview of this project is it was a marriage between the American Diabetes Association and the Shakopee Mdewakanton Sioux community. They came together with this wonderful idea to adapt an existing diabetes nutrition education program for American Indians and Alaska Natives who have type 2 diabetes. The reason that they considered this need was important, as many of us understand, is that there's higher rates of obesity and type 2 diabetes in American Indians and Alaska Natives than non-Native counterparts, and there's a lack of specifically culturally relevant diabetes nutrition education materials for these communities and for this audience. And so Kelly and Heather and I and our team embarked on a three-year timeline, and we're going to share findings from the first year of this project, which just includes our needs assessment to understand how our communities want this program to be culturally adapted. So that's not just up to us, but we actually got the voices of people in our communities, which we'll talk here about. So the original What Can I Eat program was a wonderful development by the American Diabetes Association. It includes 5 90-minute interactive nutrition-specific classes that are taught by dietitians, and it's nutrition-specific. So it's one of the only diabetes education programs that is only about nutrition. The program has topics such as using the plate method, working with carbohydrates, understanding how to cook and shop and eat out at special events for people who have diabetes. And it has a mindful nutrition component as well as physical activity component in each of the 5 classes. And so as part of our needs assessment, we did 3 things during that first year. The first was to do a literature review to see what has been done out there already on the topic, so we don't reinvent the wheel. We also did a robust qualitative needs assessment, which we'll talk about a lot more today, a health literacy review to make sure that the materials are readable and understandable for communities, and then we provided a report to our sponsors. Our qualitative methods included both focus groups with people, American Indians, Alaska Natives who have type 2 diabetes and their family members, community-based key informant interviews with registered dietitians, certified diabetes educators who serve these communities, and then content expert interviews across the country with individuals who have expertise in serving these audiences and providing education materials. So some of the questions we asked in our focus groups and interviews are listed up here. We really just wanted to understand, again, from the community, what their experience with diabetes nutrition education has already been, what they wish they had, what they'd like more resources in, how they've learned about traditional foods, and how to incorporate into that diabetes diet. And so we did the focus groups in 4 locations across the country, trying really hard to kind of span the country the best we could. And Heather's going to talk more about her specific site in upstate New York.
So the Diabetes Center is located in Akwesasne. We have a unique location that you can see on the map. The northern portion of the reservation lies within the 2 Canadian provinces of Ontario and Quebec, and the southern portion is in the United States in New York. The prevalence of diabetes from our user population is 16%, and you can compare that to the prevalence in New York at 9.5%.
Thanks, Heather. And so this slide just shows how many people we actually got to speak to across all 4 sites, and it's always important to remember this is a collective voice as we adapted the program and provided our recommendations for how best to adapt the program for our Native communities. So our findings. One of the major findings that we heard loud and clear across the country is the reminder that Native American, American Indian is not a homogeneous audience, right? There's a lot of diversity between tribes, between regions, even between ages, that our older adults have different needs than younger adults who have type 2 diabetes, and we need to accommodate for all those differences. We also heard loud and clear that we really need to come at this with a strength-based approach and think about what the facilitators to healthy eating, such as the traditional foods that we've been talking about this conference, traditional food acquisition habits, and really making a community-based education effort versus just focusing on the one person who has diabetes. We also learned that we might need to provide education on how to shift some social norms and traditions. Celebrations are really popular and important in Native communities, but a lot of times the food served at those events are not always the healthiest. So how can we shift that a little bit through nutrition education? Of course, we heard about barriers and what makes it hard to eat healthy with diabetes. Some of them were environmental, such as food insecurity, lack of access to healthful food, lack of nutrition education was specifically from some of the younger moms who maybe never really learned how to cook or just don't have that skill set. And then lack of time came up a lot. People have the illusion that healthy eating has to take more time. Class format, probably the biggest thing we heard is we need a lot of opportunity for peer-to-peer discussion. We also need to make sure that the educators are Native and or someone that's intimately familiar with the community and a trusted member of the community. And we want to acknowledge, as Kelly mentioned, we're fortunate to be sponsored by the American Diabetes Association and the Shakopee Mdewakanton Sioux community right here in Minnesota, our host. So we're so grateful for the opportunity. Our 4 site coordinators are listed up here, and they've been instrumental in helping us get this project off the ground. And we're working into our next phase is piloting the program across those sites. So thank you.